very beginning, we've been a hybrid model where we do urgent care and we do occupational medicine. And so we're able to treat high acuity patients. We're probably in the 5th percentile or 95th percentile for acuity relative to being able to treat corneal foreign bodies, fractures, large lacerations, tendon repairs, and that type of thing. So our level of acuity is high. We treat, though, coughs, colds, sore throats, sprained ankles, influenza. We can do pregnancy tests, urinalysis, mono tests, and other types of CLIA waived testing here at our office. So it's very convenient for patients to get a full service experience, and that keeps them coming back to our clinics when they can't get in their family doctor or they don't want to go to the ER. Well, all of our clinics are new. They're kept well. We take care of them so they present well to the patients, clean, efficient, both in terms of flow and how we lay out the clinic with the supplies and such. And so we want to develop a scalable model for other clinics, so we do it same way every time if we can. If there's a build out, then sometimes it's a bit different, but it makes sense to use the same template. It helps control costs on the build out too when you're using same materials, same design, same structure, that type of thing. Yeah, our ideal customer would vary. It would be the soccer moms that have children that might have an injury or something like that, or the children that's sick. So young and growing families with children would be a key market segment for us, as well as sort of the athlete. The weekend warrior athlete is a good patient for us too, because they get injured, they're not quite in as great a shape as they should be, and so they have issues coming up. And so that's an important area. Also, the occupational medicine clients, injured workers, pre-employment physicals, pre-employment drug testing, and that type of thing is another very key segment for us. As I mentioned, we're 60% urgent care and 40% occupational medicine on a mix for our patients. Yeah, the interest in this model is because we fit very well between the primary care doctors, the family doctors, the pediatricians, and the ER, where the folks don't want to necessarily spend the time and money in the ER. They can't get into their primary care because they're booked. They can come into urgent care without an appointment, so it's very convenient. Physicians' immediate care is most definitely seeking to build relationships with local hospitals, collaborative relationships, care coordination, joint ventures, any type of relationship that they are interested in. We are very interested as well. We feel that we want to be a part of the community, and that's being with the hospital. I think there's synergies back and forth that we can take advantage of together and have a busier clinic and a successful clinic. I'd probably also say to the leaders of hospitals that they need to be part of it. If they're taking risk as an ACO and they need urgent care to help to ensure patients getting to the proper destination, both in terms of the care they need but the cost incurred of that care. So that's an important thing for the C-suite folks at hospitals to decide. And if they decide they want to do it themselves, then there's a large capital investment, and it's a challenge obviously to be profitable. And so those of in our business here, we've been around for 26 years, going on 27. We have 32 offices, and we've been able to be successful doing that, so they could decide, well, should we build it or collaborate with it and joint venture with it. So.